It sounds like this is really great news for remote care management expansion. In your view, is this kind of a vote in favor and let's move forward on remote care in general?
Yeah, I mean, the biggest leap is still Medicaid and people that have not aged into Medicare yet or have not qualified for Medicare at this time. I would like to see it expand to that Medicaid market, especially for FQHCs and rural health centers, as they are generally servicing a large Medicaid population. But for now, we've now opened up this whole new world for a lot of clinics that are working with patients that maybe don't have access to care as frequently as they need, and that might need ultimately more touch points. So with chronic care management, we can help with assessments, social needs determinants of health, and can really identify where the gaps in care are for patients. And now we've opened up remote patient monitoring. So the science meets some of these assessments and health coaching where we can monitor patients that have either been recently discharged from a facility or hospital, post-procedure, maybe they're on medication, and hopefully we can help monitor that medication and their vitals as they come in with remote monitoring. And now we're going to be able to prevent and help a lot of clinics with their outcomes and any readmissions or initial admissions into facilities. So we're just able to do more good for those patients and for people who have hard access to care, like a remote health center where maybe transportation needs are difficult to get to those sites. Patients aren't coming in as frequently as they should. We can fill those gaps in between those visits with more comprehensive care.
Yeah, I mean, certainly during the pandemic, telehealth really, bridged the gap there when people really needed care and exploded that entire industry for sure. And then I think patients got a taste of it and said, you know what? We're not giving this up. This is really great and convenient for us. I don't want you to have to go into the entire Medicare rule, but is there a few couple details that call out for clinicians that they want to know on this ruling that's kind of key points?
Yeah, I think the major points is that we only know what we know, and this is a great start with Medicare. But for right now, these codes are only available. This G code is specific for FQHCs and specific for rural health centers, but only specifically for Medicare. There'll still be some Medicare Advantage plans where you need to use different codes. They'll still cover the service, but it'll be under a different fee schedule and CPT code. And all that's based on your contracting and how you're contracted with these private payers. And like I mentioned earlier, it's really unfortunate that we haven't seen a lot of great coverage for these services in the Medicaid population. But I think that is the next step as we continue to improve outcomes and to show the cost savings to Medicare as a whole. Then one would assume or hope that we're going to make that leap into Medicaid. So I'd be really careful on where you implement these and what patient populations. But at the same time, this is a new revenue source for those clinics if they need it, and it's also good for patients to act for access and care, and we can help bridge that. Whether we're now implementing a telehealth and televisits as well on top of it to just monitoring the patients in their home. It just opens up a whole new world for us as a possible third party, but specifically for patients and clinics.